Hello, scholars. My name is Dr. Karis Dillon, and the goal of this channel is to make academic subjects easier to understand. If you haven't already done so, please click that subscribe button and like button so I can continue to bring the videos you desire. Now, in the last video, we looked at generalized anxiety disorder. In this video, we're going to look at obsessive compulsive disorder. So let's begin. Do you know who Howie Mandel is? He is a famous comic and host of Deal or No Deal, and he struggles with OCD, which stands for Obsessive Compulsive Disorder. He specifically has trouble with germs, bacteria, dirt, viruses, essentially anything that could possibly get him sick. But before we get into talking about OCD and how it affects people, let's talk about what an obsession is and what a compulsion is. Obsessions are considered reoccurring or chronic images, urges, or thoughts that are not wanted by the individual that's having them. These images, urges, or thoughts cause distress to the individual. The person that is having these unwanted disturbances will try to either suppress them or ignore them, or essentially act out a compulsion. So what the heck then is a compulsion? A compulsion is some type of repeated behavior or a repeated mental act. If it was a repeated behavior, it would be something like saying certain numbers out loud, washing one's hands, checking the stove, checking the door to make sure it's locked. Repeating a mental act could be, an example could be performing counting within one's head, praying, or acting out a certain mental sequence within your brain. When that obsession takes place, the individual says that they feel this kind of force within them that they have to perform this set of behaviors, and they tend to be pretty rigid about doing that. The point of the behaviors is to reduce the distress or the anxiety that's centered around whatever situation they're worried about that will happen. Like in the case of Howie Mandel, he worries about germs, viruses, bacteria, and so his compulsion is to not touch doorknobs. It's not to touch anything that has a public handle on it, and he doesn't like to shake people's hands. These are some of the things that kind of trigger him or set him off. These behaviors did not prevent the person from actually having a bad incident take place and can become very life-altering or life-limiting. So in order to be diagnosed with OCD, a person has to have obsessions and compulsions, as we just discussed, but they also have to have those obsessions and compulsions take quite a bit of time away from their lives. And the DSM-V says no more than 1 hour per day. So if they have that or more, then they are part of the criteria for OCD, obsessive compulsive disorder. These compulsions, these obsessions will impact the person's education, job, and then relationships with others. So it impacts or distresses the ability to get together with others and to do things successfully. C, the symptoms of OCD will not have anything to do with taking other drugs or having a medical condition. So they don't have OCD because of another medical condition or because of any drugs that they're taking. And then D, the symptoms are not better explained by some other mental condition. So not autism spectrum disorder, not anxiety or panic disorder. Those are what makes this different from panic disorder or anxiety disorders is the O part of it, the obsessions, and then the compulsions, the behaviors that are used to work out or reduce the anxiety. Now, the individual will want to specify if the individual has good or fair insight. And what that means is, does the person have the ability to understand that the thoughts that they're having really aren't true? They may be kind of fighting them in their head, or they might say, yeah, I know these. Howie Mandel is a great example of this. He knows that that is not the case, but he still cannot always control that. So he's got good or fair insight, and that is a majority of people that have OCD. Now there's with poor insight, and these are individuals that believe their obsessions or compulsions are probably true. And then we have with absent insight or delusional beliefs. And this is when people believe that their obsessions and compulsions are absolutely true. So the other specifier with this is tic-related. Apparently, there are about 30% of cases of people with OCD that also have a history of tic disorder within their lives. Now, if a person has OCD, they probably have beliefs that are not true about the world around them or themselves. Many times, these persons will kind of overestimate the threat within the world and then their responsibility with that threat. Those individuals that do not like surprises, that seek perfectionism, or they need to control their own thoughts are at risk for the disorder. Most individuals with the disorder have some understanding that their beliefs are probably not accurate. Less than 4% believe their thoughts are true and that their obsessions and compulsions are true. Whether or not a person believes that their compulsions and their obsessions, the thoughts behind them are true or not, this kind of will wax and wane as they go through life with OCD. Those that believe their obsessions and compulsions are absolutely true and they don't switch that, they do not do well in the long term, generally in life. 30% of individuals with OCD have tic disorder. This tends to be seen with boys that are diagnosed with OCD in childhood. For those that are diagnosed with OCD, each person tends to have a different severity with the disorder. There are certain themes that tend to be present with many different individuals, including the fear of being contaminated or getting some sort of viral or bacterial infection. And this can bring about cleaning rituals or showering or bath rituals. There's also a theme of symmetry. These are individuals with OCD that want certain things put in an order, or they want something alphabetized, or they can't handle things being moved within their environment. An additional theme is forbidden or taboo thoughts. So these could be religious thoughts that come about, the fear of becoming too aggressive or too sexual. And then lastly, there's a fear of harming others or harming oneself. And that tends to lead to checking things multiple times, like, oh, I think my stove is going to blow up. I've got to make sure that it's off. And they check that 20 times to make sure that it's off. That reduces their anxiety or their distress each time they do that. But of course, it takes away from other productive things. The compulsions can come by getting everything to look just right. This sometimes will reduce anxiety, or it gives a feeling of someone that has accomplished something, and so they'll feel better. But sometimes they continue to feel incomplete with things that are around them. Sometimes rituals can help make people feel better about things, but even people with OCD, there are some individuals that will perform the ritual and be absolutely disgusted by themselves that they continue to perform it. For others, it helps to reduce anxiety and does make them feel a bit better. For those that have triggers, they may desperately try to avoid going to certain places or meeting with certain people so that they don't have to go through any of those obsessions or compulsions. Within 1 year in the US, 1.2% of people are diagnosed with OCD. Females tend to be diagnosed a little more than males with the disorder. The average year of onset is 19.5 years old. 1/4 of the cases start at 14 years old. Males tend to be diagnosed at earlier ages as compared to women. When children are diagnosed as teenagers, 40% will experience remission by their 20s. Compulsions tend to be more observable than obsessions and can be diagnosed more easily. If a person has a first-degree relative with OCD, their risk of having OCD is 2 times that of the average population. The themes of OCD, contamination, self-harm, thoughts, are cultural, and we see them throughout the world. Suicidal thoughts are common in about half of persons diagnosed with OCD, and then suicidal attempts are seen with about 25% of individuals with OCD. This disorder also occurs along with various anxiety disorders and depression. Lifetime tic disorder as well as trichotillomania and excoriation can also go along with OCD as well. All right, we're at the end of the video. If you have any comments or questions, please leave them in the chat box down below. Other than that, I hope you are having an amazing day, and I will talk with you soon. Bye-bye.